an interesting topic for you today. When skin cancer affects the face, and particularly the nose, treatment options for patients have been limited, leaving patients at times with deformities or even prosthetics for their face. Well, there are new frontiers opening in this treatment of skin cancer, and in the Center for Regenerative Medicine, Mayo Clinic facial, plastic, and reconstructive surgeons and researchers have developed regenerative techniques that can rebuild a nose, including the function, like the ability to breathe, to sneeze, and to smell. I'm delighted to be here today with Dr. Brittany Howard, who is a head and neck surgeon who specializes in facial plastics and reconstruction, and she's going to tell us more about this today. Thanks for being here, Dr. Howard.
Thank you so much for having me. It's an absolute pleasure to join y'all.
Well, our listeners know that I love to learn something new every day, and this is certainly going to be that topic for me. Can you tell us, first of all, why would someone need to have this type of surgery, and how common is it to need it?
This surgery is a relatively uncommon surgery when you look at the nation or a region as a whole. However, it's very common for us here at the Mayo Clinic, and particularly in my small group. This is something that for us, instead of being very rare, is actually a weekly, if not more frequent than that, occurrence that we're doing these surgeries. And the most common reasons why we are rebuilding noses, be it a small component or even the entire thing, is skin cancer, trauma, or a birth abnormality that someone was born with.
Well, we all hear that skin cancer is on the rise. And does this mean that you are seeing more patients who need reconstructive surgery?
Absolutely. I think that it is two parts for us. One is that skin cancer is on the rise, and we have a generation that lived out in the sun and got sun exposure and were taught that that was normal and to paste themselves with iodine or other things to get that nice rosy tan glow. And now, as we continue to age, we're starting to see them unfortunately have the side effects of skin cancer. Additionally, down here, as we've developed this kind of small group of experts in this, and people are recognizing that level of expertise that's quite unique, we're seeing more and more people come to us from even across the country and internationally for care.
I'm one of those people who used to lay out in the Texas sun and bake with iodine and baby oil on when I was a teenager. And if you just think, if you could go back and not do something that dumb.
Absolutely.
Both because of concern for skin cancer and aging, quite frankly. But so live and learn, right?
No, absolutely. I share that same problem with you. I'm from southern New Mexico, so the sun was ubiquitous with our every single day life.
What is unique about Mayo Clinic's approach to how we manage these patients?
I think that there's a couple of parts that ultimately just comes down to an incredible team that's been put together. So the first and foremost thing is that if an individual has this type of problems, particularly from skin cancer, you have to treat the cancer first. And that can never be forgotten, that that is the number one priority. Anything that is less than that, when individuals ask, well, can we do a little less? That sounds scary, is that if any cancer is left behind, ultimately we're going to have a bigger problem in future. So Dr. Ochoa is our Mohs surgeon down here, and she and I pair frequently on taking care of these individuals. I actually was typing her off an email right before we got on this about another individual that needs help with the same problem. And having a very close-knit team that can start from the very beginning with treating the cancer all the way to the end for reconstruction is so imperative. Additionally, we have team members that are very uniquely trained, and I'm one of those. I'm dual fellowship trained in head and neck microvascular reconstruction and also facial plastics and reconstruction. The number of individuals that have my dual fellowship is literally something we counted on, probably about two hands in this entire country. So with that, we've elevated this to a very unique level of expertise and specialty.
We hear so much the word regenerative medicine tossed around. Can you tell our listeners just a little bit about what is regenerative medicine and how does it apply to the surgeries that you do?
Regenerative medicine is this wonderful technology and advancement that we're seeing in medicine, but hammering down on that definition, just like you asked, can be really difficult. I think that for a lot of us, we automatically think about stem cells or growing an ear in a petri dish or on the back of a mouse, and it's more than that, which is wonderful for our patients and for those of us that love doing it. because I'm not a basic lab researcher. I'm a surgeon and a clinician, and thank goodness we pair with people that are, because each of us have our own strengths and skills. So to really answer the question of what is regenerative medicine, we've tried to come up with a definition that suits our patients and population is naturally recognized. And that is that regenerative medicine is anything, be it treatment, surgery, or otherwise, that restores someone to a form or function they previously had. So with that, when we talk about reconstruction from cancer or trauma, as you can imagine, that's exactly what we're talking about. And when we think about it as a forward moving and new growth area of medicine, we're thinking about the advancements that keep us on the cutting edge of that restoring form and restoring function.
That's a great explanation. I admit that when I think about regenerative medicine and what you're doing with a nose, I was like, are you growing noses in the lab, or how do you do this? Could you tell us, Dr. Howard, briefly the steps for this surgical process that you take patients through?
So for me, I think of it as three kind of big steps. The first one, once they get through whatever process got them to us for reconstruction, is templating and designing the reconstruction that we need. And so when we see a defect in a nose, the old approach to that was fill the hole or fill the defect. But we're not trying to fill a hole or fill a defect, we're trying to restore the normal. So we go through very extensive processes of templating, modeling, and designing exactly what we're going to be doing. And that's part of what regenerative medicine can help us with 3D printing, with specialized three-dimensional photographs and modeling that we're able to do. The next step is actually transferring and establishing that shape. And so once you've transferred everything, it's creating the three-dimensional structure specific for noses. Redoing something on someone's cheek or on a flatter, smoother part of the body doesn't involve the same three-dimensional kind of build out that we have to achieve with the nose. And then the last part of that is finessing and improving your final kind of outcome and result. So that's often where we end up bring in things like stem cells and different types of healing modifiers to get people from being very good to absolutely wonderful with their outcomes from their reconstructions.
When you talk about having a 3D model, and then what do you do with that 3D model? Is it in a lab and you're growing something on it, or how do you apply it to the patient?
Everybody's a little bit different because everyone's problems and defects are different. For our most common ones, which have to do with cancers or things where we are working on relatively tight turnarounds of someone just had a cancer, had it removed, and we immediately need to transfer into restoring them so that they don't have a significant defect for an extended period of time. It's something that is done continuously in the operating room. So starting with getting pictures 1 or 2 days before, templating and modeling out what we need, and then we need to actually build the nose out of tissue, but there's no other three-dimensional tissue that quite matches a nose. So most commonly we're looking at taking skin from elsewhere, be it on the cheek of the face or classically up on the forehead, and bringing that down onto the nose, but we now need to transform something from a three-dimensional nose into a flat forehead and then back out. And that's where those kind of templates and models, doing this transformation from 3D to 2D, and then bringing it back to 3D come in. And so we draw out templates on the forehead, bring that down connected by a bridge from the forehead to the nose, and then over a series of surgeries, start building out the inside structure and the outside shape.
What you said earlier about defects and filling them in sort of resonated with me. I had a relative when I was much younger who had a major defect in their nose, and I remember it being profoundly impactful and how it looked very different when they repaired that part of the nose than it did previously.
Yes, absolutely. It's something that having these abnormalities on our face is really profound to people and how it affects them for their day-to-day lives. It's how we interact with each other. It affects our confidence, our willingness to go out, to have relationships, to maintain even family relationships. And so it's so important to get people restored back to where they would like to be, even if it may not be exactly where they started.
Dr. Howard, what can you tell us about the length of this process and what the recovery time is for patients?
Very classically, when we have large defects where we are having to do these multiple stage procedures, because you can only do so much each time, the tissue in the body will only tolerate so much. What we are looking at is a series of somewhere between 2 to even 5 or 6 surgeries, and each surgery is spaced 3 to 4 weeks apart. So my patients and I end up with these very close relationships because from start to end, we'll often see each other weekly across 5 or 6 months.
Wow, so it is a process.
It is a big process, and they are amazing for taking it on and going through it. It's wonderful when they're done and through and can just move on with their lives.
Can you tell us, is this typically covered by insurance, or do the patients typically self-pay?
This is something that very gratefully is completely covered by insurance typically. This is considered reconstruction and restoration, and so we have always been able to get this covered. Sometimes you'll have some of the final processes of perfecting things, be it with our technologies of laser and stem cells, that we have to work with insurance to try to get that covered. And it's not as obvious to insurance why that's still part of reconstruction, but we fight very hard for our patients that this is all reconstructive.
If a patient would need this type of surgery, how do they go about getting it? And are there many centers where this is available?
There are quite a few individuals that do specialize in facial reconstruction for big nasal defects where people have lost half or all of their nose. There aren't that many centers that do this, and certainly that do it much. But we are one, and large academic centers tend to be the primary locations where these surgeries are done. And we typically encounter and meet patients because they come in by one of two pathways. Either they come in through dermatology or one of our other cancer specialties with a new diagnosis of cancer, and everyone recognizes that, oh dear, this is going to be a future problem, and they're brought over to us for discussion about the upcoming reconstruction and their cancer surgery and how those two will meet together to give them restoration of their original form and function. Or they've already had a trauma or had a cancer treated and come into us specifically into my team just for the reconstructive questions.
So I know that part of what you do and what we do at Mayo Clinic is to continue to try to research and perfect and improve techniques. And I'm wondering, what do you see on the horizon for this procedure? What are the areas that you're working on improving?
This is an area that I think we've got some really incredible and wonderful improvements coming down towards us in future that we're really excited about. For all nasal defects and kind of facial reconstruction is the improvement and improved speed of working with 3D modeling and 3D printing. Historically, the turnaround times for some of that were a limitation. As we're getting that technology perfected, we're getting to the point where even on short turnaround times, again, such as, cancer surgery one day, next day reconstruction, we can start to get that modeling process, further enhanced with computer modeling, with these 3D printings, with better templates. On the pure science cell standpoint, we're continuing to do more research with using stem cells and the various methods of grafting them to improve patients' healing, improve outcomes in scarring, in texture, in look, in feel, and in function. And then on the other component of that is big steps forward in surgery. One of the classic, really difficult problems to deal with in nasal reconstruction was the total loss of a nose. And for that, really only prosthetics have been something that looks good. They don't necessarily function well, but they look better than anything we could truly achieve in surgery. I previously was at University of North Carolina, and working with the team there, we came up with a novel way of doing total nasal reconstructions using different free flaps and different tissue transfer techniques, and really saw a phenomenal sudden kind of jump forward in our functional and our aesthetic outcomes for our patients using that. And we're really excited to integrate that here now at the Mayo Clinic.
Thanks for being with us today, Dr. Brittany Howard, surgeon at the Mayo Clinic, sharing with us about facial reconstruction techniques and new frontiers that are being developed. And thank you everyone for being here. We wish you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on podcasts. Thanks for listening and be well.